So, Fair Deal is a scheme of financial support for those who may require long-term residential care. At the moment, we're supporting 24,150 residents across 525 nursing homes across the country.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're looking at the Nursing Home Support Scheme, also known as the Fair Deal Scheme. Many of us with our families will have to discuss nursing home care at some stage, so I'm joined by Ultan Hynes from the National Nursing Home Support Scheme Office and Amanda Casey, HSE Chief Social Worker. You're both very welcome to the podcast, guys.
Thank you, Fergal.
Thanks, Fergal.
So this is a challenging and some places complex and some places straightforward issue. We want to get some clarity on it for the listeners. And before we kind of discuss the basics, Amanda, you've worked as a medical social worker. Would you be able to tell us more about nursing home care? How often this is going to come up with families?
Sure. Yeah, I worked as a medical social worker for almost 20 years, so I would have, I suppose, worked with and supported a lot of patients and families through that nursing home application process. Often social workers in hospitals will work as part of a multidisciplinary team, providing that sort of holistic care that many patients, particularly older patients, need. I think the role of the social worker specifically is to provide sort of emotional and practical support for patients and their families whilst they're in acute hospital care. And the role can be really varied, I guess, in a hospital setting. Some of the work would be around coping with a diagnosis. Some would be around coping with changes in terms of our abilities, our dependence on other people as a result of an illness. And sometimes that can be financial, housing, relationship. All of those things can be impacted by our physical and our medical conditions. We would also work with groups who are experiencing homelessness, who are experiencing addiction, mental health difficulties. But broadly, what our aim would be is to support the patient and their family to deal with whatever the implications of their acute hospital stay is. And in many cases, that is actually around supporting people to make choices around what next steps are when their acute hospital care is needed.
So that's nursing home care in some cases, so you have to get into the nuts and bolts on that.
Yeah. So it kind of ranges from home support right through to nursing home care. And so we would often be the first health professional that might sit with a family and with a patient to look at what is needed and what those next steps will look like.
Okay, so that's a big decision for families.
Absolutely, yeah.
What do you suggest families could do to prepare for that stage or that transition in a way?
Yeah, so I think it is a huge decision, and it can be a very emotional decision for families because I think no two people are in the same circumstances. So for every family it's different, and for every patient it's different. And certainly in my experience, we would have had patients who have had a change in their circumstances really, really quickly, often overnight. If someone, for example, has a stroke, they could potentially go from being very healthy and independent to suddenly being quite dependent on others for their care. And you're trying to make a decision in the middle of all of that crisis and trying to understand that big change in your life. For others, it is maybe the end of a process over a number of years with, say, a degenerative disease like Alzheimer's, where somebody has sort of gone from needing smaller amounts of care and over the months or years has progressed to now needing full-time care where they're unable to remain at home, even with home supports. So again, it's important that we understand that no two people are the same and no two decisions are the same. And I think a lot of families sort of struggle with the idea that they are having to place a loved one in a nursing home and what that means for them and for their families. So it's important, I think, certainly for me as a social worker, that we give families the time and the space to actually talk through what's going to be needed next and what that might mean for them as a family.
Yeah, I think it's so important to acknowledge those feelings that you just did there, that they're going through. It's stressful and there's so many various implications. I'm sure, Ultan, you come across this. The reality of the people applying for nursing home support are going through various emotions. It's a challenging time.
Yeah, completely, Fergal. And look, we acknowledge that fully and appreciate it. It's just a huge decision for people to make. And even in families, as Amanda said there can be very much differences of opinion as to what should happen. So it can be a difficult time. And then we present them with a Fair Deal application form, which at first glance is a rather sizable document.
Right.
I suppose I can't say to you that everything that's in there that we're looking for we need. If we didn't, we wouldn't be needing it. We did some research, market research a number of years ago with HSE Comms, and we actually asked people who had filled out the application, what did they think? And we got two messages back. Firstly, they wanted all the information in the one place. Right. And secondly, as they worked through the application, they wanted to know why they were doing it and what was required on this page. So over the last few years, we've updated our application form, and We now have an information section at the beginning. So the first 12 pages is information about the scheme. And then as you work through the 7 sections, and just to be clear, most people only actually fill out 4 sections of it. But as you work through the 7 sections, each of them, it talks you through what we need and, what this box means and what supporting documentation you need. So we're hopeful that that has been a huge advantage to people in filling out the application. Now, we would say to people that, look, it is a big document when you pick it up, so don't be overwhelmed by it. Just try and read through it for half an hour and then start filling it out.
So it's necessary to get your headspace into that, but you've done a lot of work in the background to try and learn about improving the process, improving the communication of the challenge.
Of the challenge, yeah. So, one of the really interesting things actually from the market research that we did, we know that the majority of people who actually do most of the legwork, let's say, filling out the application, are between 45 and 55 years of age.
Okay.
So the applicant may be submitting the application and they have to once they have capacity. But it's their son or daughter or somebody, or even could be a medical social work assistant, but generally in the community, it's a person between 45 and 55 years of age. And I suppose intuitively, that's the age at which your parents are probably in their 80s and whatever and going into a nursing.
Yeah, that's a huge amount of our staff are in that age bracket.
Yeah.
We often reference our own staff in the podcast, even though, it's a public podcast, but you're kind of brushing shoulders with the middle-aged colleagues all the time, and they're moving into that phase of life where their children need less care, but their parents may need more care. You're going to be coming across these people, as you said, Ultan, from the community, but, they're just your normal colleagues. This is going to be coming in a lot of people's in-tray at some stage, isn't it?
Mm-hmm. It is. And when I was working in the hospital, it's amazing the number of colleagues who would come up and say, can I ask you a question? Because my mother or my aunt or somebody within their family is suddenly facing into this decision and this process. And like that, we all, I think certainly my experience from the changes in the form, it's actually having, as you say, all of the information in one place, being able to actually sit down and spend time with someone, literally walking them through it and saying, so in order to fill out part 1, this is what you're going to need to source. And for some people, it's really easy because thankfully for those who have planned ahead and thought ahead, you kind of might have given an indication, this is where my bank statements are, or this is where my bank accounts are. For others, maybe, and often in a time of crisis, it's more difficult because they may not necessarily know straight away where that information is. So again, really the process differs from person to person, and it's important that the information that's available through the application process is as clear as possible to help people through that.
Advanced planning can't be underestimated, can it? We had a previous episode around Advanced Healthcare Directive with Caoimhe and our colleagues. We can't underestimate the usefulness and the power and the stress it can take out if there's consultation with the family and there's planning.
Absolutely. There's the emotional piece where we would, we'd always encourage, talk to your family, tell your family what it is that you'd like to happen next, what your will and preference is. If, for example, there's a particular nursing home that some of your neighbours have gone to or some of your friends that you've been to and you like the idea of, or that you've had a good experience with, to let people know, because that information is power for the person who may need to make those decisions on your behalf. And then there's the very practical side of thing where I know the HSE has been really actively trying to kind of encourage and promote people to get involved in advanced planning for their own future around sort of creating an enduring power of attorney, around creating an advanced healthcare directive, which are really important pieces of information that you then leave for your family or carers so that they understand what it is that you want to happen next. And it's giving you the decision-making power for as long as is possible.
Okay, Ultan, let's get into the basics of the scheme here, because I think people that are going to be listening to this may have some frustrations, may have some concerns, and we've acknowledged it here, so we need to address it. Like, this is a stress. People have concerns. So I want you to explain the basics of the scheme in terms of somebody thinking they're going to have to pick this up.
Okay. So Fair Deal is a scheme of financial support for those who may require long-term residential care. So at the moment, we're supporting 24,150 residents across 525 nursing homes across the country. Yeah, there's over 30,000 registered long-term residential care beds, but they would be occupied by different groups of people, but we're supporting 24,150. So the scheme is funded to 1.25 billion in 2025.
That's a huge, but just, I suppose it's so expensive, isn't it?
Yeah, it's almost 5% of the entire health spend. So it's a very, very well resourced. Government have resourced this scheme very, very well.
Well,
yeah. So you pay part of your nursing home fees and the HSE pay the rest. So as part of the application process, we undertake both the care needs assessment and we undertake a financial assessment. And the financial assessment then tells us what's your client contribution, your weekly client contribution towards your cost of care. So the scheme operates for public, voluntary and private nursing homes across the country. They're all registered with HIQA and they've also signed up to NHSS. So there's 525 of those nursing homes.
So people will be familiar with HIQA from their own communications, but they're obviously the quality control of these. So anyone that's registered with them is on the system.
If they're registered with them and they have an agreement, there's a very small number of nursing homes that are actually HIQA registered, but not in NHSS for particular reasons. But there's about 543 nursing homes, but 525 are in. So if anybody's concerned about that, the list of registered public and private nursing homes are available on the HSE website on the Fair Deal section. And that gives details of the nursing home by county and it gives contact details for each nursing home as well.
Okay.
If someone is searching for a nursing home, that's a good starting point if they're looking to know what nursing home might be available in their area with contact details.
Okay, so the application then, if this is falling on my lap here, you're after explaining the outline of how it works, the application process. I'm new to this now. I've got this information. Let's say I'm working on behalf of one of my parents. So what does it look like for me?
You apply using the NHSS application form. So the application form is available on the HSE website at the Fair Deal section. You can download it from that section. It's also available through the nursing home support offices. There are 17 of those across the country. And again, contact details for those are on both the application form and the website. And a number of community care offices will also have application forms. So there are 7 sections on the application form. The majority of people will only be filling out 4 sections, the first 4. We need details of the applicant, we need details for the care needs assessment, and then we need your financial details. And that's the application for first aid support. Now, there's a number of optional extras as well, including the ancillary state support, which is the nursing home loan. Only 18% of people, so less than 20% of people actually apply for Part 5 on the application form.
When you say there's 7 parts to it, and I can see the diagram in the guidance here and the information, it kind of paints a picture of what this 7 parts are, but I mightn't have to fill in the 7 parts.
No, everybody will need to fill in the first 4 sections.
Okay.
So less than 20% of people are availing of ancillary state support, so therefore 20% of people only will be filling out that section. The next section is on the 3-year cap on farms and relevant businesses. Again, a very small percentage, a really small percentage of people avail of that. Now, if it's relevant to you, it's a significant financial benefit, and there's a lot of information on the application form, a lot of information on the website about how you work through that process.
Okay.
And the last section's got to do with co-decision making arrangements, which is part of the Assisted Decision Making Capacity Act.
Okay, and that's the piece we were talking about before, yeah. So it's all laid out there. Take some time to go through it. There's information and there's support around it. We'll put those links in the podcast information like we always do. So if you're looking for the references here, just go into the podcast information, wherever you're listening to this, and you'll see the links to what Ultan is referencing there to take us straight back to the website. Okay, so they're the basics of the scheme. You've gone through the 4 stages. You've given us there some overview. You have the helicopter view here on all these applications, and your insights are quite interesting in terms of, where you can see people getting stuck. So the majority of people, for the biggest percentage of people, what would you say to the Joe Blogs out there?
So when we look at, say, everybody who applied in 2024, all right, 32%, so 1 in 3 of those people is a very straightforward application. So they have an income source, which is a pension, usually a state pension. They have a sum of money in the bank.
Okay.
They don't own a property. So in terms of the amount of detail they need to put on the application form, essentially that person has a pension and 10 grand in the credit union, without stereotyping, but that's the type of person, right? Okay. And they don't own their house.
Right.
So that's a very simple application for them to fill out. And it's also a very simple application for us to process. Now, we're then into, from there up to 90%, where we have people who have a pension, possibly a second income. They will own their property, and they may have other financial investments as well, in varying degrees of complexity. Now, we're looking at the top 8 or 9% of applications then, and they are complex applications. And really, Amanda's spoken to half the reason earlier on, it's when financial affairs are not in order.
Yeah.
So, for instance, people could own a property or own land, but it's not actually in their name. So, therefore, we won't be able to give them ancillary state support until such time as that's regularised.
They own land, but it's not in their name.
Not in their name. So, for instance, we have come across cases where the farm is in the name of the person's grandfather.
Oh, yes.
Going into care.
So they've never been regularised.
They've never been regularised, so they never did probate.
Right.
Because obviously that person inherited. They were the only person to inherit it.
Yeah.
Their son may have inherited it, and now that person's going to a nursing home. So this can cause significant delays in us processing an application. And again, it's about having your affairs in order. The other issue, I suppose, really is where if the person doesn't have the capacity to make an application themselves, a specified person, and again, that's a family member, and it's defined in the Act and it's defined in the application form, they can apply on the person's behalf.
Right.
Okay. For state support. Now, if they're applying for the nursing home loan for ancillary state support and the person doesn't have capacity, they will most probably have to apply to the courts to be appointed a decision-making representative. And there is a time lag that takes a period of time. So again, there may be a delay around that. The other level of complexity for that 8-9% of applications comes from the actual just sheer complexity of the financial products that they might have. So for instance, rarely, but we'd be dealing, for instance, with trust funds, for instance. A person might be the beneficiary of a trust fund.
Yeah.
And then we need to decide, well, what kind of trust is it? And that might need legal decision over that. They're absolutely entitled to apply, but it takes time for everybody to sort out what exactly are we looking at here and how much of this does this person own or what's the income from it.
So the more financial assets and more complex or unregulated financial assets, the longer it's going to take.
Unless that's organised.
Yeah.
Now, some people can come and present a sheet of paper and everything is there.
Okay.
And that's as simple as the most simple application. But these are the ones that can get complex. Just because you have assets, it doesn't mean it's complex. It's only complex if it's not clear
Oh, right. Yeah, I get you.
over the ownership or that of them.
Yes, of course. You said the application form, the care needs assessment, financial assessment, nursing home loan, and then the various sections as you need them.
Yeah. So we undertake both a care needs assessment. So that's to establish that the person actually needs long-term residential care. That'll be undertaken by a clinical professional. So that could be done, for instance, in the hospital by a consultant or by another clinical person in there. Or if the person is in the community, it could be done by, for instance, the local public health nurse. And then that's decided on. A decision is made, yes, you need long-term residential care. At the same time, we're then undertaking a financial assessment. And that's looking at your assets and your income. And it's deciding what your client contribution will be. So we take, let's say a person has a pension, we'll be charging them 80% of the weekly value of that amount of that pension, plus 7.5% of the value of the assets annually. So if they own their principal residence, we'll be looking at the value of that and they'll need to give us a valuation and we'll be saying, well, we'll be charging a 7.5% per annum of the value of that property.
So in terms of processing all that financial information that you're getting in on all these applications, it sounds like, I know you've told me that the most of them are relatively straightforward, but there is a lot of assets information and financial information. So how does that get processed by your office?
Okay, so the application will be sent then by the applicant or their family to the local nursing home support office, details on the application form obviously. And we have teams of people at each of those 17 offices whose job it is to undertake the financial assessment.
Okay.
So we have an IT system as well, which manages that for us. So each application is put on the system and that does the calculations automatically for us. It also then manages to process the invoices monthly to pay state support to the 520 nursing homes.
Very good. So your national office is working with those network of 17 offices?
Absolutely, yeah. So we manage the IT system for them, we manage the budget, etc. They make the decisions on individual applications because the applicant is an applicant of that area.
Yeah.
And there's just a lot of local knowledge and a lot of assistance and a huge amount of cooperation between the nursing home support offices, the acute hospitals and our community staff, our primary care staff, PHNs or GPs, all those people. They're all involved in this process. So that's very much a local process with local knowledge. And we also undertake the care needs assessment locally.
Okay. That's good to know. Thanks. And in terms of the timeline for all that assessment and work in your office, in terms of the biggest bucket of applications?
Yeah, they're done within 30 days.
30 days, okay.
Absolutely within 30 days, yeah. I mean, some of these applications are, not to downplay, but like they're 10-minute applications. If a person has a pension and 10 grand in the credit union, that's a 10-minute application.
Right.
The
weekly contribution then, how do you work out that? Do you have a team of scientists working on this?
So again, it's back to what the person submits as part of the financial details. So we're looking at their income, which is normally a pension. It's usually state pension. It could be a private pension on top of that. Again, in complex cases, there'll be people getting income from other investment sources, etc. So again, it's 80% of that weekly income amount is part of the charge, and it's 7.5% of the value of the assets per annum.
So people will have to send in proof of their income and assets.
Yeah, and assets.
Bank statements, pension statements.
Yeah, pension number usually, and a valuation for their property or properties.
Okay. And you mentioned the farm piece there, that it's a small number of people. There's a 3-year cap. Can you explain that briefly?
So what happens with your principal private residence, if I start with the PPR, right? What happens with your principal private residence is that after 3 years in care, we stop charging. We remove the charge for the principal residence. So you'll only be paying on your family home for 3 years. And that happens automatically. And we do that automatically, and we let the person know what's happening, and we might do a wider financial assessment if they want done at that stage. So that's obviously a significant benefit to people. If they have a second or a third property, we continue to charge at 7.5% per annum. So this benefit for the 3-year cap on farms and businesses extends the benefit on the principal private residence to very specific areas where the farm or the family business is being worked as a family farm or a family business. And again, Section 6 of the application goes through in some detail what needs to be submitted and the definition of family farms, family businesses, and the type of documentation that is needed to support that. So one of the things we did when this was coming in, we worked very closely with the Department of Agriculture and Food and the Department of Health, and any form that you need, say for a farm, right, to support that you are actively working the farm, the person who's going to take it over, you already will have from agriculture.
Okay, so it's not an extra ask.
You literally should have it in an email, or you should have it at home on file. So we really try to link to other departments there, validating work and paying grants, etc., and other type of authorizations, because farming is obviously a very, very heavily controlled area.
Thanks for that, and that's good. In terms of the paper, like this is a paper.
It's a paper exercise at the moment. We're actually working on a tender for a new IT system which will allow online applications. So that'll simplify the process for everyone.
Okay, for the current applicants, it's
a paper process.
Taking that application, it's getting your head into it, taking some time, getting advice, and then you're submitting those documents with that application.
With that application, yeah, to one of your local nursing home support office, whichever one is in your area.
Okay. And how many did you say?
We have 17 across the country.
They've been processed there?
They're being processed there, yeah.
Okay.
Yeah, and certain elements then will be done nationally as well.
Okay. The nursing home loan.
So the nursing home loan, ancillary state support, that's an optional element of the scheme. And again, details are at part 5 of the application form. So if you have a property or properties, we will obviously be including the value of those in your calculation of your client contribution. So you may wish to defer the payment of that element of your client contribution by applying for the loan. The HSE will pay that element for you. So let's say we say that your house is adding €150 to your weekly client contribution. And you'll say, well, okay, I don't want to pay that now. I want to apply for the loan. And that can be dealt with normally after I pass away.
Oh, right. So you take the value out.
We take the value out of the weekly client contribution now.
Right.
And it's paid after the person passes away.
Okay.
There's a really important feature and protection in the scheme for applicants and their loved ones and their partners at home. So if I apply for ancillary state support and I accept it, and then the person passes away, the person living at home in the house can defer the payment of the loan until after they pass away.
Oh, right.
So it's called a further deferral, and you apply for that after the person has passed away. So it protects the person at home. They don't need to pay it until after they pass away.
The family home, if it's been retained by somebody in the family,
it's normally a spouse or partner.
Okay.
But in certain very specific circumstances, other family members can as well. And again, the details are on the website as to who can apply for that. So we provide details. If you have taken out a loan and the person either leaves care or passes away, we will provide details to the next of kin at that point as to how, firstly, about potentially recouping the loan, which is done by revenue, or how they would apply for a further deferral.
Okay.
I think the key thing about the family home and ancillary state support, that if you think that you may need ASS, apply for it at the same time as state support.
If you need the ancillary state support?
If you think that you might need it,
okay.
right? you're not obliged to take it. You can withdraw at any stage. So the huge difficulty we see families having is that they don't bother applying. And then 2 months later they say, oh, hold on a second. And then they're applying at that stage, which is fine, and we will process the application. But it may take 2 or 3 months to wash through some technical difficulties there are with a title or something, their point. If they put it in at the initial bit, we'll do all the legwork behind. We'll clarify that everything is okay, get to the point of making an offer. And at that point, if they say, do you know what, I don't want it. Thanks very much, I don't want it. That's fine. They don't need to take it. So we really encourage people, if you think you need ASS, apply for it at the beginning. And again, that's a blockage that we see occurring for many people. But by just putting it on the application form, it just disappears for you.
Okay. Do you get back in touch with the families once they're in the scheme?
We do. So I suppose the main point of contact would be after 3 years in terms of the 3-year cap on the family house. There will also be other decisions. I mean, the applicants can apply for a financial reassessment every 12 months. So, for instance, if their bank accounts are reducing by paying the fees themselves, we can get a reassessment done for them every 12 months. They can just apply every 12 months for that. So again, that's a benefit available to people. I suppose it's also important to point out that if there is a change in financial circumstances, we have found a situation actually where people in nursing homes actually inherit houses or farms or money from wills from their brothers or sisters.
Yeah.
And that's a significant change in financial circumstances. Or if they were to sell their property, for instance, we'd need to be told about that as well, because that could impact on their financial assessment.
So in the award, you tell them, look, if things are changing here.
Yeah, absolutely. Yeah. And they just contact the nursing home support office, their local office. This is all in our communications, in our letters to them anyway, but just it's an important point that if there is a change in circumstances, we need to be told about that.
And if people need help with the application process, who should they be in touch with?
First, I suppose, after working through the application form, the local nursing home support offices will be able to support you on applications, yes. They basically triage applications as they come in, and if there's an issue, they'll get back and say, look, we're missing 1, 2, 3, or this isn't, or whatever. So just to speed up the process. But certainly you can contact them as well. The HSE website, the Fair Deal section on the HSE website works through, we hope, in a lot of detail in easy to read format, what's happening here in terms of the application, how it's done, what we require, etc. HSE Live actually are also very, very helpful, and we brief them regularly on Fair Deal and on changes to the scheme.
That's the free phone number.
That's the free phone number, yeah. So they can certainly point people in the right direction. And again, you know, our frontline staff in hospitals, and Amanda's just gone through in some detail the work that medical social workers and discharge planners do at acute hospitals in assisting people. Our public health nurses do the same thing, and other home support staff.
Yeah, I suppose anybody that's working with people in the community or public facing there needs to have the knowledge of the basics, the signposts, and be sensitive around these issues, don't they?
They do, yeah. And we do a lot of webinars for our own staff.
Yeah.
Our policy really is that if the first person in contact with the person or the family member who may need nursing home support care, we are endeavouring to be able to have them point that person in the right direction at least.
Yeah.
And set them in the right direction.
Okay, so you've given some of the signposts there, and again, we'll have them in the podcast information. You're talking about the hse.ie/fair deal and those local nursing home support scheme offices, the 17 of them across the country. They seem to be a crucial interchange for people who's going to be progressing these applications.
But primarily our healthcare professionals who are the first point of contact.
Okay.
Because they will set people on the right path. Now, they may not all be able to explain the intricacies of the scheme, but they will tell you where you can get information. They're absolutely key to this process. Firstly, in helping families, and secondly, in actually moving people properly and quickly through the system and getting people into the right provision of care for that day.
Yeah.
Basically in stopping delays and moving people.
Yeah.
Once we get that information right and people are put on the correct path.
Yeah, and it's important, I suppose, to have that kind of warm referral or information to encourage people to get the information together and to engage with the amount of clarity that you've tried to provide through the 7 sections that we've talked about. You know, it's a challenge, but it's not unsurmountable, and that the people have to spend some time and get into it.
Yeah, I think, again, it's about sort of taking the time at the initial stages to try and understand as much as possible the particular circumstances for that individual who now needs nursing home care, because again, family systems are complex. We don't necessarily understand the relationships that people may have had with their spouse, their siblings, their children, so we can't assume, I think, that people are going to be ready and able to step up and take on this piece of work on their behalf. So I think we need to be able to sort of have A, an understanding of the individual circumstances, but B, an understanding of the system so that we can guide people through it. And certainly, as Ultan said, to send them to the right person to get the information that they need.
Ultan, if you're assessed on your own or you're assessed as part of a couple, can you explain that piece for me?
Okay, so a person who's singly assessed, we will look at their income, and it will be 80% of their income per week. And we look at their financial and fixed assets like houses, etc. And it'll be 7.5% of the value of that per annum, divided by 52 for the weekly charge to make up their client contribution. So couples are assessed differently, assuming that one member of a couple is in care and one member of a couple is at home.
Okay.
So they're jointly assessed. So we add both of the incomes together and we add the assets together. And for the income, it's 40% of the joint income, all right?
Right.
And it's 3.75% of the joint assets. Now, there are a number of disregards. So, for instance, for a single person, we disregard the first €36,000 of the value of assets. So if your house is worth 200,000, we're just valuing it at 164,000 for calculation purposes. If a couple are coming together and the house is worth 200,000, we take off 72,000. Okay, so there is a distinction. Now, there's a third element there, and that's where both members of a couple are in care.
Yeah, that's what I was going to ask. Is my experience, it could be one person going into care, you're assessing them as a couple. So that's how a couple have been assessed. If one person goes into care, if the second member of the couple goes into care,
there's another financial reassessment at that point. We will take a different treatment on the assets.
Okay. And Amanda, I suppose it's very important to know that somebody going into care, that there isn't a huge financial pressure on the couple.
Yeah, absolutely. I think particularly when we're dealing with, say, an older couple, there can be a genuine fear that the cost of nursing home care is going to have a significant impact on the individual who remains at home. And that's why I think that distinction between the assets being, that it's a 40% of the joint income and not 80% of the overall household income is really important, because we know that there are still expenses related to being at home in terms of paying heating bills. You're still running a household as someone now where a portion of the income is going towards a nursing home care. So it's just to reassure people that there is a different way in which that's approached, where it is one member of a couple in a nursing home.
Okay, so look, as we wrap up this podcast, is there anything that you want to say? I know you've given so much detail and insights. Is there anything in terms of the listener that's out there that's tentatively looking in this area? What would your advice be to them?
So we fully appreciate that it is a very difficult time for people and their children and their families, right? We appreciate that the application form is a big document.
Yeah.
We're saying, just take it, read it. There's a lot of information there. There's people to help you through the process. For many, many people, this is a simple process.
Okay.
And I suppose the importance really of having your affairs in order.
Yeah, that's
Yeah, I think, as a nation, we probably sometimes shy away from having difficult conversations like that and planning ahead. So I think it's just my take home is to start that conversation with your parent, with your sibling, whoever it might be, just to talk about those things and to start that process so that if and when the time comes that the decision has to be made, you have a little bit more information, which I think takes away some of the fear that's associated with this process.
Yeah, we put the link back into the Advanced Healthcare Directive information as well, because having those conversations is a soft way to start,
yeah.
but if you want to put it on a firm footing and absolutely make those.
And I think the creation of an enduring power of attorney is a really, really important step that someone can take, which is giving a very clear message that this is the person I want to make decisions on my behalf. And these are the kinds of decisions I want to have them make. That power of attorney can potentially apply for the ancillary state support on your behalf if that's the power that you want to include in it. So I think taking those steps and talking through those issues with family and with healthcare professionals or whoever you might need to kind of chat to are really good proactive steps that all of us can take to plan ahead.
Okay. So on that note, I'd like to thank you both, Ultan Hynes from the National Nursing Home Support Scheme Office and Amanda Casey, HSE Chief Social Worker. Thank you very much for your participation today. You gave us some fantastic insights. It is a complex and sensitive area. And thank you to the listeners for tuning in to another episode of the HSE Talking Health and Wellbeing podcast.